Yeah, good morning, everybody. My name is Arya Sherafat. I'm, like you said, a fourth year cell biology major, and today I'm super excited to be presenting on my project, Does Stroke Cause Expansion of Transient Oligodendrocytes? I have been with the Ford Lab for 4 years now, and my amazing PI, Dr. Ford, who's here today, has been a really great mentor, so I just wanted to shout him out before I get into this presentation. So starting off with a little bit of background, what exactly is a stroke? So there are two types of strokes. We have a hemorrhagic stroke and an ischemic stroke. Hemorrhagic strokes are when there are ruptured blood vessels in the brain that leads to subsequent bleeding in that surrounding area. Ischemic strokes are when there's an arterial blockage which then causes a decrease of flow of essential oxygen and nutrients in that surrounding area as well. So since 80% of strokes are ischemic, that's really where our lab wants to focus in on. When an ischemic stroke takes place, there's going to be the central core region where it's all dead tissue. Around that is going to be the peri-infarct region where there is salvageable tissue, and then beyond that is unaffected tissue. So we really want to look into this peri-infarct region with regards to regeneration. Furthermore, stroke is the first leading cause of adult disability in the United States and the fifth leading cause of death in the United States. So really studying neuroprotection and neuroregeneration is super important. And looking at new therapeutics will really help clinically administer new therapeutics into patients and try to get better treatment options available for patients, because there's only two treatment options on the market right now, known as tissue plasminogen activator and endovascular thrombectomy, which both have a multitude of downfalls. I want to now talk a little bit more about our research lab focus and the potential therapeutic that we are researching. We are looking at neuregulin-1, which has been identified as the miracle drug. So what exactly is neuregulin-1? It's an endogenously produced protein within the family of neuregulins that have been implicated for normal brain function as well as neuroprotection following ischemia. So neuregulins work in reducing inflammatory responses induced by ischemia, and it promotes microglial initiation after stroke. So neuregulin-1 can be a potential therapeutic because exogenous treatment with neuregulin-1 has shown to reduce ischemic damage by upwards of 75%. Now, if you look at the figure on the left-hand side, exogenous neuregulin-1 treatment on the right panel really shows a minimizing ischemic damage. So this is a TTT stain, which stains metabolically active tissue red and metabolically inactive tissue white. So we're able to see that with neuregulin treatment, we were able to reduce ischemia by upwards of 75%. Additionally, neuregulin-1 easily passes the blood-brain barrier, which is huge, and it's already being used in patients for chronic heart failure. So now I want to talk a little bit about the model that our lab uses to mimic ischemia. So our old model was known as a transient middle cerebral artery occlusion, which was a super invasive surgery that we would go in and put an occlusion into the brain and therefore mimic a stroke. So now we have this new exciting model that's known as a photothrombotic middle cerebral artery occlusion. So the way that this works is we use a certain type of dye and a laser of a certain wavelength. And upon photoreactivity, an occlusion is created in the brain in a way that is much less invasive and is really an innovative, new, exciting model. It's used by other colleagues in the field, and we can really localize the stroke better and prevent further hemorrhage of the tissue. We like to conduct this stroke at bregma 0 location on the brain. So now I want to kind of shift gears a little bit into my current project in regenerative studies. So once again, I'm looking at, does stroke cause endogenous expansion of oligodendrocytes? So what exactly are oligodendrocytes? They're myelinating glial cells of the central nervous system. And as you can see by this figure over here, their plasma membranes are characteristic of wrapping around the axon of neurons. Now, this really helps with insulation of the axon and is really important for regeneration and has been studied extensively in multiple sclerosis models. But oligodendrocytes have not really been characterized yet in this photothrombotic model of stroke. So that's why these oligodendrocytes are of interest to us. But we want to further narrow in a little bit more and look at which oligodendrocytes are actively engaging in myelin formation, because that's really where a lot of the regenerative processes that are essential after ischemia takes place is important. So we really want to characterize that transient population of oligodendrocytes. So if you can see on the diagram on the right-hand side, there are oligodendrocyte precursor cells, which are essentially little baby oligodendrocytes. And then you have mature oligodendrocytes, which are full-grown mature oligodendrocytes. So we want to look at this transient population characterized by BCAS positivity through histology that is actively engaging in myelin formation and is not necessarily a baby and is not necessarily fully mature. So that's really where we want to dive in and look at what is happening in this specific model. And how are we going to do this? Through immunohistochemistry. So fluorescence staining and microscopy, we're really allowed to visualize certain markers such as BCAS positivity, as well as Olig-2, which I'll get into now. So we're going to start this project by doing an Olig-2 stain, which compares all of the oligodendrocytes in our model. We're going to compare the ipsilateral side of injury to the contralateral side. And we're going to visualize density and localization of all oligodendrocytes. From here, we're then going to look at a BCAS1 stain, and now we're going to ask which ones of those oligodendrocytes are the BCAS positive oligodendrocytes. And we're really going to try to characterize exactly what is happening with regards to ischemic damage, as well as the BCAS cell expansion that's happening in that general area. We anticipate that it would happen in the peri-infarct region, as there are multiple regenerative processes that are happening in that peri-infarct region after ischemia. So once immunohistochemistry staining was conducted, we have the Olig-2 stain on the left-hand side and the BCAS1 stain on the right-hand side. DAPI staining is the blue that you're going to see in the images, and these two were superimposed. So DAPI stains for all nuclei. Olig-2, once again, stains on the left-hand side. Olig-2 stains for all oligodendrocytes, and this is a nuclear stain, so therefore you're not going to see much morphology. But BCAS1 on the right-hand side, it shows morphology of that transient population of oligodendrocytes. So we counted these cells for every single DAPI cell that had a signal, and also a BCAS1 or Olig-2 that had a significant signal. Those cells were therefore counted. So when looking at BCAS1 in the brain after stroke, we're able to see that there is a significantly greater amount of BCAS1 positive cells on the side of ischemic damage. So when looking at the ipsilateral side specifically, we can see up here in this M1 region of the ipsilateral side, which is closest to the injury taking place, that we have the greatest amount of BCAS1 positive cells. Additionally, on the entirety of the ipsilateral side compared to the contralateral side, there is a greater number in every single region that we looked at. So when we look at Olig-2 positive staining in the brain after stroke, we realize that there's no significant increase in all oligodendrocyte populations after stroke. Instead, all oligodendrocytes were uniform throughout the entirety of the brain on both the ipsilateral side of injury and contralateral side of stroke. So Some conclusions: BCAS1 is localized in the peri-infarct region near the ischemic damage after a stroke takes place. There's a greater amount of BCAS1 seen in the M1, which is closest to the damage that it's closest to the ischemic damage that actually takes place. OLIG2 positivity is not localized throughout the brain in the same way that BCAS1 is. It's random and there's a uniform, even distribution throughout the brain. And this transient population of oligodendrocytes is really important in regenerative studies in a stroke model. So some future directions that we want to take with this project is introducing neuregulin-1 into the system and looking at BCAS expression with and without neuregulin-1 treatment, and then further characterizing oligodendrocytes within this model. Additionally, our lab really wants to promote neuregulin-1 as a safe and viable treatment option for stroke patients and get neuregulin-1 clinically into patients as soon as possible. And that concludes my presentation. Thank you all for being here today and listening to my talk. I will take questions at this time.
Great, thank you, Arya. You can stop